Role of vaccines seems to be considered the most important one to end this pandemic. So we want to make sure it goes right for everybody. There are questions related to various vaccines, and in this episode, I'm going to talk about the timing for vaccines in COVID-19 patients. I, Dr. Bharat Jagiasi, have Dr. Rahul Pandit with me. He's part of State Task Force Maharashtra, that is India. Dr. Rahul, I welcome you to podcast ISCCM.
Thank you very much, Dr. Bharat Jagiasi. It is indeed an honor and a pleasure to be on this podcast with you and for our ISCCM.
So, sir, let's straight go to the question. What should be the right timing of vaccines in COVID-19 patients? Someone who suffered from COVID, should he be going for the vaccine? And if yes, then when and what time should be deciding that?
Thank you very much, Bharat. That's a very pertinent question. If a patient has got COVID-19, he indeed should be vaccinated after he's recovered from COVID-19. And the ideal time to take the vaccine is 8 weeks after they have tested positive or 8 weeks from the onset of their first symptom. That's when they should be taking the first dose of their vaccine. And that is true for both the vaccines, whether they choose to take Covishield or they get the Covaxin, which are the two vaccines available in India currently.
Okay, my next question was that only is it different for different types of vaccine, but you answered that. So it's same for whatever vaccines you take. First dose should be taken 8 weeks after the RT-PCR was positive. And if RT-PCR was not positive, then the first symptom, they have to take it the first day. Right, sir?
Yes, correct, Bharat. But the second dose is important for both the vaccines. It is different for both the vaccines. So for the Covishield, the second dose is between 6 and 8 weeks. That's the Government of India ICMR recommendation currently. However, the WHO has said that this can be delayed if there are circumstances like non-availability of vaccine or if the person misses it out for some reason, up to 12 weeks. So they need not panic. For the Covaxin, the window is 4 weeks from after the first dose. Plus or minus few days is allowed in this as well.
So that is true for someone who had a smooth course. But what if after the first dose, someone acquires a COVID-19? So does he have to go for the second dose? And when is that possible?
Yes, again, I think a very important question, and a lot of people do have this dilemma. So if you contract COVID in between your two doses, so again, the timetable is that after the test is positive or from the onset of symptoms, you wait for 8 weeks before you take your second dose. And this would be true for both the vaccines. You wait for 8 weeks and you take your vaccine, which was Covishield or Covaxin, whatever it is. It is important that what first dose you took, you need to take the same vaccine as the second dose. You cannot interchange them.
Thank you, sir. Thanks for being with us and clearing all these doubts. It's nice to have you always. Thank you very much.
Thank you very much, Dr. Jagiasi. Thank you. It's a pleasure to be here.
That's all for today. ISCCM Podcast is production of Indian Society of Critical Care Medicine. Thanks for listening. Stay safe. See you again.